Hey guys, welcome to Beyond the Weight Room podcast. Today we have Brendan Boyle, who's an athletic trainer in the industrial setting. Brendan worked with me and Ryan over at Mercy Sport Performance, powered by Exos, and then they both decided to leave me. So I think I have some abandonment issues, and we're going to go through that today.
Yeah.
Why did you guys?
The common denominator.
Yeah.
What? That fucking restarted.
Question one: why did you leave me? Anyways, Brendan, thanks for hopping on, man. It's always good to have people on that we know. It can kind of, I don't know. We don't have to dive in too deep to what that means, but we have a good time on the podcast. So, I don't know if you have anything to say to get going, but really, my first thing I like to do with everybody is kind of just have them lay out their background a little bit, their story. Where you are right now. Obviously, me and Ryan know that, but anybody listening, the three people listening might not. So,
I can give a little backstory. So I, like Brett said, I'm a certified athletic trainer in Missouri, born and raised in St. Louis, and then I went to a small liberal arts school called Truman State University for my undergrad in athletic training. Immediately following that, I had a season-long internship with the pro team for the Kansas City Royals. So I did that for about 6 months because the Cardinals didn't want to have me. So, but that was a great experience. Learned a lot, but then realized that I didn't want to do pro baseball. I thought I wanted to going into that. And then, as Ryan can maybe attest a little bit, they kind of own you. I mean, and Brett too. I know you worked with the White Sox for a while with the Cardinals. So, and then was in St. Louis for about 4 years doing clinical rehabilitation, some high school outreach as well as an athletic trainer. And then the last year and a half, I've been in the industrial setting. I've been working with Aldi. And they're one of their distribution centers, doing a lot of ergonomics, lift training. My title is injury prevention specialist, so a lot of injury prevention, teaching people how to use their bodies well, helping them become more aware of maybe ways that they could improve their mechanics, not just at work but also with other parts of their life. So, the industrial space is still growing, so it's a pretty cool emerging setting for athletic trainers. A lot of people think it's not necessarily a fun setting to work in when you're used to working with high school athletes, college athletes, pro athletes, people that are trying to get back to some type of activity or sport. But I'd say it's probably one of the most rewarding times in my career as I'm helping people stay healthy so they can make a living and support themselves, support their families. So when you can, make a little tweak for somebody or tape their wrists and make them feel better so they can keep working, they really appreciate it. So it's pretty cool.
Yeah, dude, that's cool. I remember like when you first took that position, I didn't even know that. I mean, it makes total sense, but I never knew that was actually like a position. I'm glad that it's going that direction because it's, especially people in like the factories and stuff, probably just get beat to shit. And then that's pretty much it. Unless they're actually hurt and going to PT, they're not getting any treatment, right?
Yeah, and that's like I know for Aldi, they try to combat that a little bit. So like they can't even get their benefits like kicked in until they've been working there like 3 months because they don't want people just to get hired on and then like claim an injury or get coverage and then be out of work. So the turnover in that space is pretty high. Like I think like over the course of the year their turnover rate's like over 100%. So like usually the people they have in the building, like if they hire 50, they lose 60. So yeah,
it's like a restaurant.
It's a lot. So, I mean, and it's a really physical job. I know this is, I know both you guys are strength coaches. You talk about athletes. We talk a lot about the industrial athlete. They're not lifting 300, 400 pounds, but they're lifting 10 to 15 pounds over 1,000 times a day. Like that's a lot of volume. And then we do that 5 times a day with different types of techniques and movements and lifts. And, you're putting a lot of stress on the body. So
yeah, for sure. Yeah, that's crazy to think about it that way as in the like athletic setting. And I mean, I know you were saying, it doesn't sound necessarily maybe if you have an AT coming out of school, like everybody gets into this because they want to work with athletes. I feel like that's why we all got into this. But at the end of the day, we all end up working with general population in some capacity because there's just more general population than there is athletes in the area.
Right.
So I mean, even when you're working with Mercy in sports medicine, like you still had a ton of just general population people too, right?
Oh yeah, like when I was in the clinic, I would say at least 80% of your clientele they're physically active individuals, but yeah, they're general population. It's people that are running and have IT band pain or foot pain or hip pain, people that maybe had to have a meniscus surgery, or even some active people that had to have a hip replacement or something like that. So, but even working with those people, it's still good. It teaches you to have good communication skills with different um, demographics of people and ages of people. So yeah, I'd say most of the time you're not really working with athletes unless you're you know in a pro sport, or at a high school or a college
Yeah.
primarily.
So what do you think? Um, Obviously, money is a factor, but
Mhm.
is there anything else that drove you out of that setting? You think, like, were you?
Um, yeah, I think for me personally, like I'm more introverted by nature, and when you know, I'm talking to and trying to be attentive to people's emotions and like all the kind of weight they can dump on you in a physical therapy setting. I would just go home and I didn't want to talk to anybody. I didn't want to, interact because I had been interacting all day long, and that just wore me out. Um, so I was in the clinic full time for like a year and a half before I um, was like, yeah, I think that, yeah, obviously the money was good leaving, um, but I would say like my work stress there was like a 7 out of 10 most days, just because people are coming in expecting to feel better when they leave. Not that that's not the case where I work now, but they're paying a lot of money sometimes to do it. And so if you can't get it better, you feel bad that
Yeah.
you didn't, at least get the improvements that you wanted to see maybe in one 45-minute session. Um,
And do you feel like that's why you take out your frustrations by dry needling me?
Sometimes, yeah.
Okay.
Um, Also, dry needling's a really good tool. I knew you were going to bring that up in this. This, I was like, I don't know when, but he's going to bring up dry needling for sure.
Just stabbing people, man.
Yeah, but it gets them better. So
Can you explain a little bit for people who might not know what dry needling is, how it works, how you use it, what's your history with it? How'd you learn about it?
yeah, I learned about it from a mentor who um, did it on me and showed me by also kind of demonstrating on some other um, classmates from school. Dry needling is essentially a westernized version of acupuncture. So you're using the same type of thin, flexible filament needle, um, but the methodology that you're using is different than an Eastern medicine style of treatment. So typically, you're looking for trigger points in the muscle. So you can, let's say a quad is a common area that you would dry needle. So you would, palpate for tenderness. If the patient gives you, these are the more tender areas. Obviously, you also have an idea of there are certain muscles and certain areas in that muscle that can be more like bang for your buck. So, like the lateral quad, your vastus lateralis, for whatever reason, tends to be a kind of a hotbed for referred pain as well. So you can have pain in your hip, you can have pain down in your shin, and it can be coming from that VL muscle, for example.
Yeah,
So
dude. That was like some of the craziest stuff. I remember because I I'd heard of and knew what dry needling was, and to me, it can do a lot of different stuff, but mainly it was like bringing blood flow to some areas that needed or the trigger points, and that's kind of how I originally saw it. I think you were the first person that started talking to me about utilizing it for scar tissue and how much like scar tissue can affect just your movement patterns. We don't necessarily always think about that, but it's obviously fucking with proprioception. Like I know that from all the ACL surgeries you work with and other injuries. But it was just really interesting, like how much that you guys got into it, especially you from like the scar tissue point of it too.
Yeah, the scar tissue thing, and I don't quite totally understand why it works, but sometimes like if it works, it works. What I was taught in my course, so I've been certified in it since 2021. I'm currently not able to do it in the industrial setting, but when I went through my class for it, they said that like your brain knows and is influenced by the scar tissue through the autonomic nervous system. So like even if you have, let's say you have an ACL reconstruction and you have some scar tissue there in that knee, if that scar tissue is not dealt with appropriately, your nervous system still knows that something's off there, basically. And so you can help regulate that by attacking that scar tissue. You're never going to, fully break it up, but depending on how, aggressive you are, because with that needle, you're essentially creating, like you said, you're creating small lesions in the muscle or the tissue to basically restart the inflammation process, increase blood flow, increase tissue mobility, sometimes all the way down to through all the layers, as you would know, Brett, as I would take, a 50 millimeter needle, go all the way through your quad down to your femur and then twist it until you are about to jump off the table. So you can go all the way through that muscle and get good fascial movement as well. So it's pretty crazy. I know, Ryan, I worked with your mom a lot with some scar tissue. And I'll tell you this one quick story. One day she came in particularly with a lot of neck pain when she was trying to look up toward the ceiling. And she told me about arthroscopic knee surgery she had on her right knee. And I dry needled her knee just in the scar tissue. I didn't do anything in her quad at all. And she got off at the table and she didn't have any neck pain after that.
Interesting.
So
why do you think that is? Is it just like holding the trauma physically throughout the body? So like wherever the scar tissue is, that might be one of the sites. Is if you work through it, just generalized pain throughout the body might go away. What are your thoughts about it? I know you said you're not really sure sometimes how or why it works, but just after doing it as long as you have, what are some theories that you might have?
I think yes, holding some of that trauma in the body for sure. I look a lot at what was popularized by Thomas Myers, what he calls the anatomy train. So just your fascial slings of tissue and muscle. So specifically for your mom, the fact that she was having issues in that kind of anterior, front, what I would call a front line, superficial or deep front line tissue. It was kind of an educated guess to be like, no one's ever worked on this scar tissue. Let's just try it and see what happens. Because if you're, you could have issues down in the knee that could be causing hip pain or low back pain because, you can't move the knee here. And so you're going to have to get that range of motion or that mobility from somewhere else. So yeah, I think it's trauma. It's looking at the body as a whole. And then, apparently, somehow if you can get that nervous system, that unconscious nervous system to kind of reset with some of the needling, because you're getting physically into the tissue versus if you're doing scraping or soft tissue work, you're still affecting the nervous system, but not in the same way when you're putting a needle all the way into the tissue and affecting some of those mechanoreceptors as well.
Yeah, it's pretty crazy. I've I've been around it a little bit, and I've definitely been there when you poke Brett's femur. It's fun to watch from the outside, and then like some of the symptoms that people have afterwards, like being really sleepy or drowsy. I find that stuff. If you go back to kind of like the layman's sort of like very tightly coiled, and then you drive a needle through it, like people just kind of have this release once it's over. So it's definitely something that's interesting.
Yeah, I mean, you can see that in not even like dry needling. I feel like that's the same thing. Well, not same thing, but like same reaction when sometimes people do like breath work. We were talking about that last podcast a little bit. Like I was in a breath work ceremony and people are like relieving stress, and then people like crying and just all sweating and all this crazy stuff. It's like your body almost like, I don't know, something like switches, right? Mm-hmm. So I know when you were dry needling the scar on my foot, like, yeah, it hurt. I've had plenty of things hurt before. And I was just like sweating. Like my whole body was just, it was like, that's how I was reacting to it. That one hurt, but the quad one doesn't. I just, didn't like you smiling while you did it.
Right. Well, I had a mask. I had a mask on. You couldn't see it, but
Thank God for COVID, right?
You take pleasure in people's pain.
What?
See, well, but also think about like when you're coaching in the gym and you make some workout, you're like, they're gonna hate this, but at the end of it, like later in the week, they're like, my squat feels better, or my ankle mobility feels better, or whatever. It's kind of like that. It's like it's gonna suck, and I'm honest with people. I'm like, hey, this is gonna suck for like 2 minutes, and then it's gonna be better, and you're gonna feel a lot better. And
yeah.
They're like, okay.
If anybody's listening and hasn't done it and is looking for something to help, I mean, it's definitely worth reaching out to people because I've seen it work wonders with a lot of patients, with a lot of athletes, with myself. So not trying to like downplay that by any means. And it really doesn't hurt. Like the needle itself doesn't hurt at all because it's so freaking tiny. It's usually just like if you have to like kind of twist a little bit into like an area that's a little tight, but it's not bad at all, honestly. So I think it scares people probably when they're first coming in, and I know you guys all kind of have to like almost talk people up a little bit, a couple sessions, like, oh, they're not going to do this first session, obviously.
Right.
Versus like, I think afterwards people probably wish they would have done it earlier. So
yeah, I always, and it depends on the person, right? Like if someone comes in and they've tried everything and they're like, nothing's worked, then I will usually offer them like, hey, this is an option for you. This is, if you're talking about if it's snow to foot, do you want to use a snow plow or do you want to use a shovel? Like if you want to use a snow plow, we'll go after it and we'll use dry needling. If you want to be a little more conservative, we can do other things. That's cool too. But yeah, you can't go 0 to 100 with the needling, especially if people are scared of needles. Then yeah, you got to go. Just put a couple in, let them sit, and then.
What you said you couldn't do it in the industrial setting now. What prevents that compared to the setting you were in previously?
So with the industrial setting, technically, I am not working, or I'm not practicing as an athletic trainer. I'm practicing as a first aid provider.
Okay.
Because I know it's a little quirky, but because I'm governed under OSHA, and so that's why like my title is not a certified athletic trainer, injury prevention specialist, just injury prevention specialist. So they under OSHA, they allow you to do so many things. So that they allow you to give out durable medical equipment like soft braces, tape, things like that, compression sleeves. You can do movements and exercises, what we would call like conditioning protocols. So we can't prescribe exercises, but we can give like movement protocols, which are basically different exercises and movements that can help with stretching, mobility, things like that. We can do massage. Apparently massage is considered a first aid treatment to OSHA.
Good to know.
So we can do hands-on massage. We can do massage with a tool, aka like instrument assisted soft tissue work, and a lot of it's how you document it. So if anyone's familiar with like muscle energy techniques for like, let's say your hips are a little bit out of place, we can do that, but I would document it as like an assisted, like an IPS assisted conditioning movement or something like that.
Always ways around
Interesting,
rules, right? Like, yeah, it's I mean, they could hire you as a freaking trainer whatever.
Yeah.
You could do a lot of that stuff too. So same kind of thing. I remember when I was with the ski team, I was allowed to do personal training outside of there, but we had a relationship with the hospital next door, and one of our therapists was trying to do like cash pay therapy outside of it, hours too, and all the trainers could do that. And they were like, "Oh, you can't do that because of the relationship we have with the hospital. You're taking people away from them." And he's like, "Well, what the fuck?" He's like, "I'm literally doing like exercises, but because I'm a PT, I can't." So he's like, "Well, I have a CSCS," so he just like, "I'm personal training now." So he just like, find ways around it, right?
Yeah. I'd say that the other biggest thing is I don't diagnose anything. So basically, if someone comes to me with an injury, I can evaluate them. I can give them my like recommendations. If they want to go see the workers' comp doctor, they can. But as soon as that happens, I'm pretty much hands off, which is kind of nice. Yeah, I'm not diagnosing anything because if they hear me say one thing, then they immediately grab onto that and say, "Oh, Brendan said I have carpal tunnel." It's like, no, I didn't say that.
Yeah.
So, yeah, after listening to you kind of describe the differences between like clinical versus industrial, so do you work with other injury prevention specialists, or are you on your own?
I'm the only one at my site. I have
Okay.
other. So the company I work for right now, Accelerate Therapy Performance, they have a nationwide contract with Aldi, so they have an injury prevention specialist in every warehouse. So I have coworkers, just remote coworkers. So we have like regions. So there's like 4 or 5 of us in each region. We have meetings and things like that. But yeah, it's just me on site in one place.
So can you kind of walk us through, like, I know you're working with people. Is it similar to a clinical setting where people schedule times and come in and see you? Is this more something where you're on your feet walking around? Like, give us an insight into your day to day.
Yeah. So I'm mostly on the floor. I'd say 70 to 80% of the time on the floor. Just walking around, checking on people, looking for safety violations, safety hazards, things like that. If I can do some I'll do like formal lift training with people. So we do it like quarterly. I just kind of watch them build their pallets of food for a couple minutes, kind of give them some tips if I can. And then we can I have like a mini athletic training room with a table and hot packs, cold packs, foam rollers, stretching straps, all of the equipment, tape, braces, compression sleeves, that type of stuff. And so, yeah, they can schedule a time. Like if I'm walking around and someone says, "Hey, my shoulder's kind of been bugging me for a couple days. Can I come, after my first break or something like that?" And then, I also will, after I walk around, let's say the dry kind of grocery area side with all of the like dry products, I'll like head to my office, do a little bit of the documentation with anyone I talk to, and then at that time maybe someone will come in. They'll see I have a little light that shows I'm in my office. It's on the floor, so they might come in and say, "Hey, can I just grab a hot pack for a couple minutes or get my wrist taped? It's a little sore today, but not bugging me." And so I pretty much kind of go on the floor, kind of do my thing, talk to people, check on people, come back to my office, do some documentation, and then I would go out onto the cooler and freezer side of the warehouse. Same thing, checking on people. And then I work a little bit with our office staff as well. So I'll kind of lead some stretches just to get them moving a couple times a week as well. And then I'll do, I help with orientation. So when we have new hires that come on, I'll kind of go over different lifting techniques, things to look out for in the first couple of weeks as they're getting used to the job, and just kind of give them the ins and outs of what I can do for them to keep them working and feeling healthy.
It's interesting that this is like a relatively new field with corporations having like industrial workers. I know when I first started with Exos, it was in a general population field with Wells Fargo.
Yeah.
And like, if I'm an employer and I want my people to stay healthy, especially in something like what the people at the Aldi site are doing for you, like the more I can keep these people healthy and working, like the easier it is to not have to hire. And I know you have a lot of high turnover, but thinking more from like a business model, like keeps people on their feet, keeps people working, saves the company money in the long run. So I'm surprised like it's taken this long to get to this point where they're putting people like you in these positions to help the workers.
Well, it makes a lot of sense too, like you said, from like a money saving standpoint. Because I'll ask you guys, do you know what the average workers' comp claim like amount is, by the end of it, like for one claim? What do you think?
You could say any number right now, and
I'm gonna say $73,000.
That's a little high.
Damn,
I have no idea.
Overshot.
That's like $41,000.
Yeah, it's a lot of money.
And that's that's direct cost and indirect cost, right? So direct cost of you physically are paying for them to be out of work, or be on some type of restriction, and then also the indirect cost of now you have to hire more people, or you're taking away productivity from other people who may have to train those new employees. So just for reference, so I've been with my current company for a year and a half. In that time, we track like encounters and issues. So encounters are like, I gave you a tip on lifting. We had a general wellness consult about, nutrition or hydration. But an issue is like, there's a true mechanism, so they were lifting cans in aisle 5 and they felt a strain in their back, right? That's an issue. In that time I've been there, a year and a half, I've had over 700 resolved issues. So if you do quick math here, so 700 times, let's say 40 grand, that's $28 million.
Yeah. And that's one site.
That's one site. Now, would every issue that comes up, is it gonna, would it have resolved in, or would it have resulted in that $40,000? Probably not. But it's just the premise of, you can see true impact on the amount of, projected money you're saving a company if you can track some of those metrics. So it's, when you put it in that perspective, it's pretty staggering.
So are you, did they have somebody in this position before you? Or are you the first one at this location?
They had someone there before me. Our company went.
I just didn't know how new it was, I guess, really.
Yeah. They've had a couple people before our company, but it was kind of a very part-time role. So I think that for a while they had someone from SSM that was coming like 6 to 8 hours a week, just randomly. She would just kind of pop in, walk around, talk to a couple people, and then leave. But this is the first like full-time person they've had.
Have you been able to track like how many instances were before versus like your last year? I know it's not necessarily relevant.
Yeah, we didn't have good data because the system we were using for documentation was kind of constantly being built out with more and more features. And so some of the metrics we were testing in like middle to late 2022 and I started, and then all 2023 are a lot different. I will say for 2023, like I had, I think 500 or so issues, and then those encounters, which are just, little things here and there, little tips to kind of prevent issues from coming. I think had about 1,700 of those. So that's a lot.
Yeah.
Just kind of proactive things.
So when you go up to your boss, you bring out that $28 million, right? It's like,
that's
you're getting like a couple percent of that at least.
I did kind of present to, we have like a vice president of each division with Aldi. I did kind of present to him like our injury tracking system, kind of showed him like all the features of it, what metrics we check, and then gave him like data for our site specifically. One of the main reasons for that too is we were tracking how many of our incidences that were becoming workers' comp claims were happening when I was not on site, whether it was outside of my hours or I just wasn't notified, because that has happened too. Like people would get injured, they'll go fill out an injury report, and then I don't hear about it, and they just go. Where sometimes they get injured, and I can get them feeling better to keep working, or at least take the day off and then come back the next day. And like it was about 42% of our recordables were happening when I was not there. So then we were kind of using that to press for more coverage to try to get either another part-time or another full-time IPS person, either to cover weekends, because I just work Monday through Friday right now, or to add some extra coverage to where maybe you have one person more in the office area doing more of the admin treatment stuff, and then the other person's being more with the floor presence. So
yeah, that's interesting. It's like you can help these people out on the floor, but at the same time, it's like under OSHA, you can't give them too much. Otherwise, it'd be considered like.
Don't help them too much.
So here's a question: like, do you refer people out to connections that you have if it's something that's serious? Like, how is your communication right now with the employees of Aldi and also athletic trainers or physical therapists within the St. Louis area?
So if it's a work-related issue, I can't do anything with it. So if they fill out an injury report, they go get seen at one of the facilities who send people, and they come back with some type of restriction and they have to do physical therapy or they're out, then I don't mess with that at all. But a good example would be like someone asked me, they're like, man, I really just want to get like a massage. And I was like, okay. Like, and they're like, do you know any good massage therapists? Or do you know any good chiropractors? I just, I don't have one. I've heard, talking to Joe over here, and you said he's been going to the chiropractor for his back. Maybe it'll help. What do you think? I get this all the time. People are like, what do you think of chiropractors? And I was like, that's the most loaded question of all time. There's good ones and there's bad ones. So I can kind of do a little bit of that of like, these are a couple people that I know I've worked with or talked with that would maybe be good and helpful for you. But I can't be like, hey, go see Brett and he'll give you some workouts. I mean, I guess I technically could.
Yeah, let's do that. What the fuck?
But sorry. Actually, I did have one guy. He was asking me about programs, and I told him that he should check you out on Train Heroic.
Yeah,
So
Beef Kelly.
That's right. So if it's work related, I am pretty hands off with that. But if it's kind of more general wellness, if someone's interested in that type of stuff, I give them all the information I can from what I can legally say and not get in trouble. And then I can also be like, hey, follow this person on Instagram, or, here are some other resources that you could check out. I'm not necessarily recommending them, but you can check them out,
Just like
I gotta imagine that's hard sometimes to bite your tongue, just because I think we all get into this space to help people. But when you work under certain restrictions, there's obviously roles that you have to fit and things you cannot say. So that's an interesting dynamic right there. Do you still work with any? I know you're doing some stuff like with hockey games, working as an athletic trainer for those. Do you still do anything with sports, or what do you do on the side?
Yeah. Primarily I work a lot of youth hockey, a little bit of college hockey, just kind of as a PRN athletic trainer. I'm still a PRN for Mercy as well. So occasionally I'll work like a soccer tournament for them. Besides that, not really. I've thought about doing some cash-based stuff because I still like the puzzle piece type of work when you're in a clinic trying to figure someone's pain or dysfunction out. But I don't have a space to do it in, so maybe at some point. But yeah, just mostly just working PRN hockey for right now.
That kind of led me to my next question. You might have already answered it. Of what do you miss most about working in a clinic or with athletes?
Sticking Brett with needles.
I was gonna say me and Ryan.
Yeah. I would say I think what I really enjoy the most, and I still get to do this on my day-to-day, but just like educating, whether it's an athlete or whether it's a general population person, educating them to the best of my ability to take care of their body, with the end goal of them not needing my care or my help. And I tell people that I'm like, if I'm doing my job correctly, you shouldn't need me because I can teach you things to take care of your body. To where at the end of the day, if you have an acre of pain, you have at least 2 or 3 things in the back of your mind that you go, well, I can try these things and see if they help. And if not, then you can do some other research. But I think that's like my favorite thing about that setting of just getting people out of pain and then trying to teach them how to take care of themselves and kind of have that that autonomy to feel empowered that they can make a change on their own without having to always seek out help. Obviously, in some cases, yeah, like athletic trainers and strength coaches and PTs, like they have to sometimes go to other PTs or strength coaches or ATs to get help because they have something that they can't do. You can't mobilize your own ankle if your ankle's out of whack and your talus is jacked up. It's really hard to get that into the right place by yourself. So that's probably what I miss.
You can figure that one out though. Just hit it against a wall or something.
I mean, maybe drop a KB on it.
My foot's been hurting for 10 years, so if somebody wants to figure that one out for me, that'd be good. Anyways, so we were going to get into some homeschooling stuff, but I think we'll just bypass that.
That's fine.
We've been.
I'm proud. I'm fine with that.
Since our, are you homeschooling Teddy?
I mean, he's only 2, so I don't know yet.
Now.
It's not off the table. We'll see.
Dude, the hardest part about that, I feel like now that I'm a parent, I'm like, I don't know how we have time to do that shit.
Yeah.
It's crazy. But
I don't know.
We've been ending with some different would you rathers.
Okay.
We did that one other time. I'm not going to do Dave's because we did that 2 different times now, and it's not good. I have one that I put together a while ago. Would you rather have to always drink out of a stranger's shoe, or never know what you're drinking anytime you drink something? Neither of these will kill you.
Does the stranger change?
Yeah, it's a different stranger every time. So different shoe, different used shoe every time, but you'll know the liquid. Or
I'm going to go with that one. Yeah.
Or a glass of something that you don't know.
Or you never know what you're drinking.
Yeah, it's not going to kill you. It's not poisonous.
That sounds pretty bad.
But it could be apple juice, or it could be like sewer water.
Yeah. Well, yeah, I guess. I was thinking more or less like actual drinks, but still.
Oh, okay.
Maybe not sewer. I feel like sewer water could kill you.
Probably.
It's a tough one. Ryan, you're going with stranger shoe?
For sure, without a doubt. There's no thought in my mind that like I'm out there grinding. You come in, you're parched. You want a water or a Gatorade, and you get
vodka. You're like, fuck it. I guess I'm drinking today.
Yeah. See that I will gladly drink out of a shoe before I do that.
That's going to be our intro clip right there. I'd gladly drink it. I think I would do shoe. It's hard for me, but I have drank out of a stranger's shoe. I played rugby long enough. I had to shoot the boot a handful of times. And that was actually a liquid that I wasn't sure what it was in there, and it was in a stranger's shoe. So,
see, I think I would go. I don't know. I live a little dangerously. I'd say I'll take the risk, and I don't want to drink out of a shoe.
Dude, it could be a good risk. You could be like, oh, I'm gonna get water, and you're like, oh, that was a nice ginger ale.
Yeah,
my stomach was bothering me, but now it's not.
Like I got a kombucha. I mean, you could get a natural kombucha out of a shoe too. So
that's disgusting. I'm good there. Sweet, man. Well, it's good catching up with you. Glad things are going well. Yeah, Ryan, you got anything else, man?
No.
All right. Well, we'll definitely have you on again a little bit later, and that's all I got. Thanks for visiting, guys.
Thanks.